Were you just told you had a fibroid of your uterus and now you're like, what am I supposed to do? Hi, I'm your local OBGYN. I love women and let's talk about it. So your uterus is a thick muscle that's got a lot of very important jobs to do. It's supposed to make you have a period that it can squeeze out every single month. And then once you have babies, it's the thing that pushes that kid out. But sometimes that muscle doesn't act the way that it's supposed to, and it can actually start to grow a fibroid tumor. Tumor meaning that there's overgrowth of what the typical muscle is supposed to be doing. These tend to look like these swirly muscle growths. They are common. They are usually benign. The things that cause them are genetic predispositions, unusual hormone levels, exposures to things that mess up your hormones. There's a stronger predisposition in African American women as well. Now, what you need to know is that these usually start in early adulthood, grow through our midlife, and then once our hormones start to go away, they kind of can shrink down and stop their growing. They can be small like the size of peas. They can be big like the size of your head. Some people get symptoms, some people don't. Some people just feel the weight of them pushing on things on the inside, and some people, even when they're itty bitty small, can have excessive significant bleeding as a result, which can be super duper annoying. Now, you can get treatment for this if you're symptomatic. Some people don't have symptoms. I usually check in on them every year or two just to make sure that they're not changing in size too much, which would raise an alarm bell that there's something else going on. But for the most part, these are benign tumors that can cause heavy bleeding, cramping, or sometimes pushing around pain because there's so much going on the inside.